Hi, welcome. This is Kate Blackburn here with the Nemours team. We have a couple more minutes before we start. If you have any questions or comments in the interim, please feel free to use the chat box to send them to us, and we'll get back to you. Thanks. We're getting ready to start. It's just 12 o'clock now. We're going to give folks another minute or so to join on, and then we'll be right with you. Feel free to send messages or comments via the chat if you need to. Thanks.
Good afternoon or morning, depending on where you are. Allison Gertel-Rosenberg, Operational Vice President of National Prevention and Practice at Nemours Children's Health System, and welcome to our webinar on navigating the health system. Our Nemours is to provide leadership, institutions, and services to restore and improve the health of children through care and programs not readily available, one high standard of quality and distinction. I believe this work is in direct support of that. Nemours is one of the nation's largest integrated pediatric health systems, providing hospital and clinic-based specialty care, primary care, prevention, and health information services, as well as research and medical education programs that improving the lives of children and families throughout the Delaware Valley and in Florida, with prevention and population health in many other places across the nation. I'm pleased to be joined by my colleagues Kate Blackburn, Hughes, V. and Emily Chauncey. I'm excited to turn this over to them and to share more about this curriculum and the opportunity to work with each of you. For taking the time out of your busy schedules to join us And I hope after this webinar that we will be bringing Navigating the Health System to your institutions, communities, and states. Over to Kate Blackburn.
Thanks, Allison. Welcome, everyone. We're excited to have over 200 people, roughly 25 states, join us today to learn more about Nemours Adolescent Health Literacy Curriculum and how you can utilize it in your own schools or community settings at no cost. As Allison said, my name is Kate Blackburn. I'm joined today by Denise Hughes and Dee Long. The three of us will be taking turns presenting portions of today's agenda. Get started. Today's agenda includes a bit of background on Nemours so that you understand how this work fits into our priorities as a whole, some highlights of the health literacy curriculum and its background, of evaluation findings to date and a review of the content and materials, what to expect if you opt to use the curriculum, time for questions and answers, and a quick recap. If you have questions as we move through the information, please submit them via the chat. We'll be monitoring your questions and we'll either address them in real time or hold them for the Q&A portion of the call. In the Q&A portion, we're going to address questions from the chat first and questions verbally if time permits. We'll be unmuting all of your lines during the Q&A portion. So to prevent us from hearing background noise from the entire group, we're asking that you take a second now to mute your line and only unmute it later if you decide that you have a question or a comment during the Q&A period. Move into information on navigating the healthcare system. I'd like to provide a quick overview of Nemours Children's Health System to have context for where national expansion fits, where an expansion of the curriculum fits into our work and our priorities. Nonprofit pediatric health system that offers care in Delaware, New Jersey, and Pennsylvania, as well as Florida and Georgia. Nemours is dedicated to providing life-changing medical care and research and to training tomorrow's pediatric experts. We also focus on helping all kids grow up healthy and on advocating nationally for kids. These last two items, which are in blue text on the slide, are where the national expansion of our health literacy curriculum fits in. The healthcare system is one of many healthy living and learning resources Nemours has developed for child care and K-12 programs. This summarizes our other various resources. An electronic version, since we know this font is very small and difficult to read, will be as part of the follow-up email sent to anyone who registered for today's webinar. I encourage you to familiarize yourself with the various resources that we offer and tap in to whatever your needs. The Kids Health in the Classroom newsletter is a great way to get information on all of our resources. The sign up is listed at the bottom of this slide and will also be included with the materials sent after today's webinar. So why are we so excited about navigating the healthcare system curriculum? Here are some of the main reasons, and they're based on feedback from current user community. It's at no cost. It has strong evaluation outcomes from a statistically meaningful sample size. The content is aligned with national health education standards. Pre-post tests are available for your use but not required. Video-based training for presenters simplifies the logistics of getting your presenters trained. The team here at Nemours is available to provide technical assistance and answer questions as you launch and use the curriculum. This workbook is available as a printable PDF file and also in electronic format that can be completed online. All materials are accessible via Google Drive, and users have access to supplemental materials shared by our national network of other users. So we'll learn more about each of these items during the presentation, but just wanted to kind of give you some highlights to get started. By the end, we hope that you'll be as excited about this opportunity as we are. So to set the stage, I'm going to turn things over to Denise Hughes, who will get into the history and details of the curriculum.
Hi, everyone. Thank you for joining us. We did this project back in 2010. We started working with adolescents out in our community. And we really wanted to know what they thought, and we wanted to make sure everybody had a voice. So we did a project called Photo Voice. And in the project, we gave adolescents cameras, and we had them go out in their communities and take pictures of things that helped them to be healthy and prevented them from being healthy. And based on the outcome of that photography project, we found out that the adolescents were hearing health messages, but we couldn't put in practice what these messages meant. So for instance, if you can see on screen the chicken flavor, the adolescents we worked with said that that was healthy because they were eating their peas and carrots and they were getting their vegetables. The top right, see a picture of Scrapple, kind of like Spam for those of you not on the East Coast. They also said that was healthy because they were eating breakfast, and breakfast is one of the most important meals. So we finished up with Photo Voice. We went on and we decided to do some focus groups, and we did adolescent focus groups and parent focus groups. They were in separate rooms. We even separated the boys and the girls to make sure that girls weren't shy around guys and vice versa, because adolescence is changes are happening. And for that, we asked them what messages, who are their trusted resources, where to go for health information. And parents all told us that their kids come to them or they go to the counselor or a teacher at school. The adolescents, on the other hand, told us that they talk to each other or they go to the internet for information. We also asked them, do they know who their current doctors are? Do they know how to make an appointment? And they did not. And from that, we asked both parents and students if we created a health unit around how to navigate the healthcare system and find out these other tools, would they be interested? And overwhelmingly, everybody said yes. So to the office and started doing some research. We found a lot of curricula out there for children with special healthcare needs, but we didn't find anything for the general population. Started doing some digging and seeing what was out there, and we found also that the challenge was adolescents lack the skills, and we want to really engage and empower them to take control of their health. Had a high school update from us, and we went knock on the door and asked them if we could pilot test this in her classroom because we are not teachers. We didn't know how to teach it in a classroom setting. We do research, we know how to find content, and she said yes. So we together, originally it was a 6 curriculum, and we taught it to the students. And the students told us what they liked, what they hated, what needed to go, what could stay. That we went back to work, and then we got it down to a 4-unit module. All the bullet points on highlights that Kate just mentioned was access to supplemental materials shared by a national network of users. So this just kind of started happening without prompting. Over the years, we've had multiple teachers join on, try things in their classroom. It didn't work, so the teachers then started submitting us activities, videos, different materials that they used with their students that work, and share them with everybody who is teaching the health unit, so that way they feel free to use it, and that way it becomes more of a community project. And also have ownership of the project, and it's just us. And our user community, we're considering creating a virtual user community to allow our users to connect and share directly with one another by creating a user group in Facebook or by creating and navigating the healthcare system Twitter that users can follow. We're interested in knowing if this is something that interests you, and a couple of polling questions related to this idea. First, do you regularly use Facebook? Do you regularly use Twitter? If we were to navigating the healthcare system user community on social media, do you think you would use it? And we'll results for this in a little while. We're going to discuss the implementation results that have occurred in Delaware. We give a pre and a post test prior to the health unit being implemented in the class and then after it was done being taught. In 14-15, really the first year we taught it in a classroom. So me and some of my colleagues went out to 4 different high schools. We taught in 8 classrooms. One of them was a special ed class so that we can make sure it could be in the general population and special ed, so not necessarily children with medical complexities, but they were able to be in general track high school classroom. We also looked at socioeconomic status, rural, urban, suburban throughout the way we made sure we covered our basis. In 2015 and 16 is the first year we trained teachers to teach it because we wanted to make sure that a health teacher could teach it or a teacher who was teaching a health class could teach it. And then in 2016 and 17, it just spread to other schools. And you can take a look quickly at the results. You see they pretty all started between 60 and 64%, ended between 80 and 82%, and all of them were statistically significant. And we only were able to count schools where we got back the pre and the post test. So sometimes one or the other was missing or the teacher misplaced them completely, so we weren't able to include the analysis. If we looked at the number of students who received the workbook year begin 2015-16, we've reached over 2,000 students in Delaware. This is currently part of regulations in Delaware to be taught in a health class. So the teachers that are doing this because they feel their students really need this skill when they graduate. Things are mandated to be taught in health class, and so that's some of our challenges have been lack of time by teachers who are not teaching this. We started having a few states reach out to us, and we did the pilot nationally in Wisconsin, Illinois, and Texas. You can see they had similar growth just like Delaware did. So in doing this, looked at the type of teacher who was teaching it. So we wanted to see if a health teacher provided a better situation than a health science teacher, which are our medical health career in our high schools. The school nurse taught it in some situations, and the physical education teacher taught it. And you can see here it didn't matter what type of teacher you were. Results were pretty similar. The only difference we really saw was the students in the health science classes started a higher baseline knowledge than the students in the general health phys, and that we did that to them being in a medical career pathway in high school. We looked at, and it's not on this slide, whether it was the teacher's first time teaching it or fifth time teaching it, because we wanted to see if the level of education provided to the students was the same, and if they got as much value out of it, whether the teacher was more comfortable or just starting out with the material, and it did not matter if it was the teacher's first or fifth time teaching it. The results stayed the same. Then we also asked students when we finished if they thought it was helpful, and overwhelmingly they thought it was helpful. They thought others their age should learn the information that they would know better what to do at their next doctor's appointment. They felt the information wasn't confusing for them. And overall, they felt the materials were helpful. And we're going to try to look at the polls. Any poll results yet? Hang with me for a second. The poll has ended. I can't see. I'm going to turn it over to V, since we appear to be having some difficulty with the polls.
Can everyone hear me?
Yeah.
Okay, perfect. So this 4-unit curriculum comes with all the materials and resources that you'll need. Instructor training materials that provide you with everything you will need to know about teaching the health unit and all of the available resources. You will have presentation materials, which include prepared slides, workbooks for your students, activity kits with lessons, videos, and interactive games, all to help reinforce the lessons for your students. Finally, you will have materials available online as pre and post tests to help you quantify your students' progress. The slide shows our workbooks. So will be available in hard copies like the ones on this slide and also online. Matter of fact, all of our materials will be available via Google Drive. Sample workbook pages and demonstration videos can be accessed using the link on the slide. With you how all your online materials will look like. Screenshots of online modules for instructors and students. As you can see, the topics are broken apart into different sections, and the online tools are very easy to use. The website and sign-on instructions will be provided to all instructors once your organization signs up for this health unit. I want to hear that our goal is to make this interactive and convenient as possible for both instructors and students. Next slide, please. All schools in the Navigator healthcare system address the National Common Core standards and are also in alignment with the National Health Education Standards. The modules focus on preparing students in grades 9 to 12 to better be their own health advocates. Each prepares students to better at comprehending and analyzing key concepts related to health and health promotion, accessing health resources and information to make informed health decisions, and finally, presenting health information, findings, and evidence clearly and concisely with diverse partners. So taught in a variety of different settings, such as in groups, and or lead. Our partners are very creative with this in the past. That unit has been taught in a variety of different settings, such as community-based, after-school programs, and within the juvenile system. Each is very adaptable and user-friendly. A module can be taught individually within 45 minutes. Each module can also be broken down into 10 to 15-minute segments with topic areas that includes videos. We heard from our user community that teachers like this because they can incorporate training into their current teaching curriculum. This helps make it easier for students to digest the materials. I will hand this back to Denise, who will provide you with a more in-depth review of the 4 modules. Thanks.
So the results of your poll shows about 57% of you use Facebook, handful of you use Twitter, and about half of you would be interested in creating a community. So that's great. So break down the modules and discuss the content in them, and just to kind of give you an overview of what content would be to be delivered to your populations. So the first module goes over definitions. It talks about self-advocacy, which is the running theme throughout the whole health unit. The different types of doctors, so what's a primary care physician, what is a specialist, proper use of the emergency department versus an urgent care center, and importance of family and medical history. In the second module, we talk about symptoms, diagnosis, allergies, and then medications, and we talk about the difference between over-the-counter, prescription, how to read a label, and then we home vaccinations and give them resources, specifically the CDC's vaccine schedule. In module 3, which is actually the most popular module, the students really enjoy the insurance conversation, and then we also inform them about their confidentiality and their rights as adolescents for obtaining care. And then the fourth module, we kind of tie it all together, and it's all about making and navigating their visit, filling out the medical forms, checking out, getting your prescription. So we're going to do a quick video that we always use to introduce this module. So hang tight.
This is a POS and not a PPO. A PPO? It's a POS. I want a POS or I have a POS? You have a POS. Do you want me to have a PPO? You have a POS and not a PPO. Then I want a PPO. You have a POS. It's like an HMO. It means you need a referral from a PCP. A primary care physician. POS means I need a PCP? Referral.
See in that video, there's a lot of jargon being thrown around. The reason we use this is because this is what a lot of people actually experience when they go to the doctor. It's very confusing, they don't understand, they're being told or asked for something, they really don't know what it means. And we really wanted to make sure that the adolescents had to be themselves, because in a few years they're going to be cut off from their parents and have to do this on their own. Mom and dad can no longer make those phone calls for them. So in Module 1, we really start to discuss vocabulary. We always start out with health, healthcare, health literacy, and self-advocacy. We identify the different types of doctors. We determine where to go for appropriate care, and then we also discuss family health nation and have them do a family health history form and like an interview sheet at home so that they can talk to their parents. But we also let them know adoption comes up, and we'll cover that in a couple minutes when I get to that slide. So then for the definition piece, draw a concept map. They can write a paragraph, and these are some pictures that students have submitted to teachers have shared with us just to give other folks who are using this health unit an idea of what we were kind of talking about. So this is, from the student's perspective, how these 4 words interact with each other. This was kind of my favorite one, not gonna lie. Then we go on and we talk about how do you make a peanut butter and jelly sandwich. So not everybody makes a peanut butter and jelly sandwich. Typically when we ask this question, we get, I get bread, put some peanut on it, put some jelly on it, smash it together and eat it. So how would somebody know how to make your peanut butter and jelly sandwich? And I'll give the example. If we make a boysenberry jam, chunky peanut butter sandwich on pumpernickel bread, everybody in the room would eat it, and they all kind of look at you like it's the most disgusting thing in the world. And then they start saying, well, I only eat grape jam, or I only eat this kind of jam. We really hone in on being specific and get back to being your own self-advocate. So if you don't tell your other doctor or provider when you go to see them what needs and wants are, they can't help you as best as they can because they read minds. So we really talk to adolescents, and we really want to empower them to use their voice. Over personal and family medical history. So we used this family tree. We made this poor child very sick. It was very purposeful. We gave grandma breast cancer at age 30 on purpose because they don't start screening until age 40. So if you're not screening for something until 40, but you have a family history at 30, we want to make sure that they realize that's something they need to tell the provider. We also let them know that men breast cancer, so we gave great-grandpa breast cancer. And like I said earlier, the adoption thing comes up several times, and we let students know that it's very important for them to keep track of themselves going forward. No, they may not know their past history, but as long as they start keeping track and as they go to the doctor and they can keep a record of it, that way they can better help their families as they go along in life. So then on to Module 2, and really talking about symptoms, diagnoses, and allergies, and we briefly go over that. We find basic types of medication, so over-the-counter versus prescription. We talk about appropriate use of medication, and we use this game Kahoot, and the students really love it. They get very competitive when we do it. And then reading a medicine label. And vaccines, we do a fact and myth and share the CDC schedule to let them know these are the vaccines that are available to you. If you're missing some and you've passed the ages on there, we also share the catch-up schedule with them. So labels we use, and we really go over the whole label and why it's important. It's a lot of different conversations that happen. So one there, if you look at the directions, it says take 2 pills every 4 hours if you are a child and adult over 12 years of age. We ask them, if you're not feeling better after 2 hours, should you take more? And we hope they know, but most of them we get some yeses in there. We also give them a scenario about lactose, because this particular medication has lactose in it. So Johnny's outside playing, he falls down, or to sneeze, he comes inside, and you're like, hey, I'm going to give this to Johnny. And all the mom's like, wait, because it has lactose in it, and he's allergic to lactose. So we really hone in on why reading the whole label is important, and not just looking at the ingredients and everything else. We talk about storage, etc. And then I want to talk about facts and myths. The one that generates the most conversation here is the HPV vaccine is only given to girls because it protects against cervical cancer, so boys don't need it. Get all the comments. We've had gentlemen stand up in class and say, well, I hope boys should get it because I got it. We've also been asked where it's given in guys. So to dispel some fears. But we don't push these on anybody. It's just more of giving them the information around the vaccines. Module 3, we talk about insurance and privacy. And in this module, we really go over the different types of insurance. So private insurance versus government insurance, reinsurance card, there's an activity on that. And we talk about privacy laws and their right to the doctor without their parent for prevention purposes, pregnancy, and STDs. We also let them know that they talk to their parents because of the explanation of benefits being sent home. Their parents could find out about it, so we always reinforce having open communications with your parents, but we know that's not always possible in some situations. The visit is marked confidential, so if their parents do request the records, it should not be in there, but people make mistakes and sometimes it may slip through the cracks. We just let them know that they are able to receive care, and we really want them to receive care and not just put it off because of fear. So on the next slide, you'll see 4 insurance cards, and this is the insurance activity we do. So one of the first questions we always ask them is can you see the ID number on the Blue Cross Blue Shield card, which is the B? And they always give us just the numbers and leave out the letters, and they said, because you asked us for the ID number. So that was something that we learned, and it even applies when we ask for the group number in one of the questions. They get very confused when they see the letters. So very concrete. We talk about prescriptions and how do they know if the card covers prescription or not, because some plans you have 4 or 5 insurance cards, you have a dental one, a medical one, a vision one, prescription. So there are many incidences where multiple cards. We let them know that that's common. And we all tell them to go home and ask their parents for a copy of their card, especially because they're going to be driving and you know what was them. Last module, we really hone in on putting it all into practice, making your visit, navigating through your visit. So we really identify the important information that need to share when making an appointment. They don't need to know that you play soccer. They need to know what type of visit they need to make for you, when you're available. Have transportation to get there, so you need to make sure that they check their schedules. We want them to know how to schedule an appointment, how to complete the medical forms. They're very daunting and overwhelming, and then have a very good dinner around this because a lot of questions happen at this point in the health unit. So I'm going to turn it back over to V to go over some responsibilities.
Thanks. So before I get into roles and responsibilities, just want to stress that this easy and easy-to-use nature of the curriculum has been something that our existing partners cite as a major plus, along with being available at no cost to you. Okay, so roles and responsibilities. I'd like to show you the roles and responsibilities for Nemours and our partner organization. So for Nemours, we will be responsible for all onboarding and orienting of the partner organization. We will provide all of the relevant resources that you will need for your unit. We will also provide technical assistance throughout this whole process for you, as well as co-branding of electronic materials upon request. And for partnership, we will continuously provide our user community, our partner organizations, with relevant resources and updates regarding health unit. So for our organizations, the first thing we would like you to do is to create an implementation plan. It does not have to be formal. Our goal is really to ensure that we are all on the same page regarding implementation of the health unit to ensure a smooth execution. Partners are responsible for coordinating and facilitating video-based training and presentation of our unit with all instructors in their organizations. Partners are responsible for adhering to the terms and conditions in the user agreement for publication and recognition. And finally, all partners are expected to submit data usage quarterly, which is very easy to do, and I can explain that more on the next slide. So all will be reported through Google Sheets, and it will take you less than 10 minutes to enter your data. So it's a pretty light lift, and we haven't heard any complaints from our partners yet. So we ask that you report your data using at least once every 3 months. That we will leave it up to you to decide how often you'll submit and who will enter the data. To report the data once you sign the user agreement with us. So the usage data you'll be asked to report shown on the slide. As you can see, items 1 to 10 won't change much, and 1 to 8 won't change much. So it's really a matter of dropping in new data on classes and presenters that you'll have to worry about. The actual form includes instructions and explanations, and of course, we are available to field any questions that you may have. Next, please. Process is typically straightforward. Our email address is on the slide for you. Once you're interested and you spoke to your organization about it and you want to become a member, a user, you would just email our email address and we will reply to you with a blank memo of agreement, list of information we'll need you to complete for the agreement. So your legal department and or those with signing authority will review the document and will let us know if your organization can sign the document as is, or there are aspects of legal language that you would like for us to consider altering. Now, few organizations have requested modifications, and it can be done. How I'd like to just let you know, modifications can add significant time to the onboarding process. The all modification process will have to be queued through the Nemours office. Organization plans to sign the document as is. You will provide us with some basic information to fill in the agreement, and from there we will sign it, provide you with links to all of the materials, and Jill will call to orient you to the materials and to answer any questions you may have. Now, we're advising to allow up to 3 months for the onboarding process to account for any unanticipated delays on our part or yours, and to account for the fact that we will be onboarding a large number of organizations during this period. That being said, our goal is still to make sure that you start with a time frame you're comfortable with, and we'll definitely work to make sure that that happens. If we need to fast track your process, then we will. Slide, please. As we move on to the Q&A portion of the agenda, we invite you to use the link in the chat box to answer these 3 questions after our end. Your response will give us a sense of how many new users we need to plan for. The link will also be included in the post-webinar email that you receive later. And that's it up for me, so I'll pass this over back to Kate.
So thanks, Dee. Let's move into the Q&A portion of our call. So we've been monitoring questions along the way. We have a few. Please continue to use the chat area on the right-hand side if you want to submit questions or you want to submit comments. We're going to address any of the questions that have come into the chat first, and then we'll open the lines for anybody that wants to add something or ask questions verbally. Again, please remember to mute your own line at this point so that when we unmute everybody, we're not inundated with the background noise of, 200 and so people in their offices. The other thing that has come up just in terms of one question right off the bat, I've seen a lot of people ask us if copies of the slides will be available, and yes, you'll be getting a link with copies of the slides actually at the end of this presentation, and then also in the materials that we will be sending out as a follow-up. Everybody will get an email with the link to not only the slides, but also the recording of the webinar. So that being said, let's start with a couple of the questions that have come through the chat.
Great. And Denise and Dee, who is the user community? Is it adults working youth, or is it for youth directly?
You want to take it?
I think that question may have been the poll. I think it popped up during the poll. But our user community for this, in terms of who we're getting materials from and resources, would be, those that are presenting the curriculum. So we're thinking about the organizations that partner with us and whether they're using adults or they're using trained teenagers to present the information. That community of users is welcome to, share materials with us and among themselves.
So today it has been the organization that shares the materials, but some of them are youth created, and they share them through their leadership or whoever they are working with to give us the materials that we can share with everybody else.
Are the materials free?
Yes.
Yes. I would note, this is Kate, I would just note that we'll be giving you access to all of the materials through Google Drive, so you can download all of them. If you are the person that loves hard copies, you could potentially incur some printing costs if you were going to print the student workbook and you wanted hard copies as opposed to the online version. I suppose you could have printing costs associated with that, but it would be very, nominal, no cost on our end.
Can you talk about how the curriculum is devised? Is it one unit with 4 modules?
Yes. Unit, it's 4 modules. Each module takes approximately 45 minutes. So we've had some teachers break it down into 10 to 15-minute blocks if they're not in a typical classroom setting. So after-school programs, they have 10 minutes each day dedicated to this. So do it by topic area. In Delaware, classrooms have 90-minute classes, so they do Module 1 and 2 on day 1, Module 3 and 4 on the second day. So everyone kind of does it at their own pace and at their own speed. The only thing we've had them do, some of them even change the order of it because it fit in better with something else. But really just provide key highlights, so it's not really scripted, they have to read it verbatim. Just want to make sure that they hone in on the important pieces of the content.
And this is Kate, I would just add that that's some of the feedback that we've gotten from our current user community is that they really appreciate the flexibility and the, set up such that they can use it however makes sense for their setting.
Speaking of settings, how do you think that this could be best implemented in a hospital system?
hospital systems have advisory committees, and ours actually started looking into potentially doing this. They have a youth advisory committee, and they wanted to talk to the youth to see if the youth would be willing to teach their peers. Some diabetes clinics already have classes, so they were contemplating adding it on those classes. Another health system that we work with is contemplating teaching their staff this, so that way when they're in the room and they have a lot of community outreach that they do, they can then use a piece of this in the community.
We've also heard about summer intern programs incorporating this as a possibility as well.
Mm-hmm. One of the things, too, is that we've had a couple of health systems talk about making it available to their associates, that they could get home and have a sort of a home use situation. So it's very, very flexible.
Preferred audience, is it schools, is it communities, is it both and all?
All. We really just want to help people be able to do this. It's very daunting. A lot of adults don't know how to do it. So being a children's health system, we start adolescents. As they are aging out of our system, we wanted them to be prepared. We reached out and worked with schools because it was an easy fit for us. We had been working with schools for a very long time, and the opportunity presented itself to put in a health classroom, and the teachers just bought it and thought it was a necessary skill. So.
Age group, I know that we've had a couple of people ask us in the past, is it kind of in all high school students? Are there certain grades that you prefer? Denise, you want to speak to that?
So in Delaware, it's done in 10th grade because our health is, but in our career tech ed classes, the seniors are taking it because the health teachers feel, or the career tech ed teachers feel they're going to be graduating, so it's really going to be real. But in health class, it's a kind of a catch-all, so we have freshmen through seniors taking it. Really hits the gamut of high school age students.
Great. So a question here, I think, is a summary, which is, say I want to replace my health unit for next year. What do I have to do right now to get in place so that I go at the next school year? Kate, can you just walk through the steps again really quickly about the process?
So what you would need to do is just send an email to the, again, the email will be, it's on the slides, and it'll be included in our follow-up materials that we send to everyone that registered. But the email address, just to say quickly, is NTHCS@nemours.org. So you just shoot an email to us. The team, we share responsibility for monitoring that. One of us will get back to you and start the onboarding process. So that'll happen pretty quickly. We'll email you. We'll let you know what we need to do to sign the user agreement. It's generally a pretty fast process unless we need to make changes to the legal language on your end. And then once you've signed off on that, it's as simple as us sending you links to all of the materials. You would go through them, and then if you need help, we'll help you talk through your implementation plan. But that's really up to you. It's up to each user to figure out, you know, okay, I'm going to be the point person for Nemours, and then I'm going to train how many people? Okay, who are those people going to be? When are we training them? Is it going to be a group training, or am I going to let everybody do it individually? Then who's our audience? Which young people? When during the day are we going to see them? Will they be in a group? Will they be in small groups? Is it a classroom? Is it an after school? So if you really think through all of your implementation details, you're ready to roll. I mean, again, we'll help you think through those details if this is new to you. Happy to have those conversations, but really the minute that you sign the user agreement, we'll send you links to all of the information, and you've got it all self-contained and ready to go. Definitely do not see that there would be any issue with somebody being ready to use it for next fall. Sure. We've had people reaching out now because they want to field test it and get comfortable with it over the summer so that they can implement fully next academic year.
Great. The program is only available in certain states.
And all states, territories can use this, absolutely. The more the merrier. We're really excited to get this information out there.
We know that all states can do this, all communities, all institutions, if they're willing to sign an MOU with us. Can you tell how a state or local public health department could work with you to be an organization that gets training into the hands of their grantees, school districts, et cetera?
Yes. I think we can talk. Denise has worked with some public health departments and even some state departments of health, things at that level, and everybody's come up with, there's been a number of different scenarios. We also have a lot of universities that have partnerships with schools. So I'll just say, again, we're here to talk. We're talk with each of you individually to think through your implementation plan, but I'm also going to ask Denise to speak to some of the scenarios that we have in place right now.
So in Texas and Wisconsin, we have been working with the public health departments in various locations, and some of them have trained their public health nurses to go out and teach it. Some of them have partnerships with schools, so they train teachers to teach it. They go to, it's been an immense homeless shelter via public health departments. They've gone to juvenile justice systems. And same with the universities. They have a variety of connections in their community, and some of the students who graduated, they implemented this as part of their graduate training, and then when their students graduate, they go on to work with various organizations. So some of them have connected with schools, some of them are in other healthcare organizations now, and they have brought that to their population. So it's been done in a variety of ways, and we can be happy to further discuss different ways that this has happened.
Yep.
Denise, I know you talked a lot about how this has been developed for general health. Has it been tested with any youth who might need support in navigating the mental health system?
Specifically, no. It's just been in the general health care system, right? And we haven't gotten any further in testing it in other scenarios.
We're very interested in the different scenarios, but we've also had people ask about, have we tested it using peer educators, so maybe high school seniors presenting it to freshmen and sophomores. So if there are specific scenarios that anybody's interested in talking about, you know, certain ways to test it, we're very interested in having those conversations with you and to track what finding. You know, we're really thinking about this as a user community.
A reminder, because there's a couple of questions that have come across, these slides will be available as well as an audio recording of this at a link that we sent out post.
Actually, no, I'll go to the next slide, not because we're not gone to next steps yet. However, here on this slide, there is the link on the third section of the content on the current slide is where you can access the slides, the other materials. The recording, obviously, since we're still live, is not currently up there, but will be up there by Monday.
And then a couple more questions before we open this up. Well, we want everyone to implement all of this. What if people can't implement the entire 4 modules? Are there other ways of doing this?
We had people just pick it apart and pick which topics were most important to them. Like we said earlier, it can be broken down by topic in 10 to 15 minute increments, something more than nothing.
Yeah. And actually, that raises a point. In the user agreement that we have everybody sign, there's some language that speaks to that. So the results that Denise highlighted in the earlier slides are based on using the curriculum in its entirety and this sort of flow that it's presented in. But, you know, the user agreement, we really speak to. If you want to change it around, go ahead. I mean, you just, as long as you understand that if you change it around, your results may vary. As long as you're willing to you know, acknowledge that, that's absolutely fine.
And just came in. We found that the curriculum works the same for English language learners or English as a second language youth. Have you used this with other diverse youth, urban, race, ethnicity, LGBT, et cetera? Anything special to keep in mind?
So all above with the exception of English as a second language. We currently, everything is translated into Spanish. We are in the process of rolling it all out. Our first pilot will be happening in a couple of weeks. So we haven't specifically taught it in Spanish, but it will be taught in Spanish. The workbook is available in Spanish, and students who were Spanish speakers as a primary language were given that book as an option. So it's kind of along with to hopefully bridge that gap. We tried originally when we did it in schools. We asked a lot if we could give them the Spanish version, if they wanted it taught in Spanish, and a lot of them said, no, we teach all day in English, so that's kind of what we stuck to. But it has been tried on a variety of different populations.
And this, just adding, the more anybody is doing a special focus on a specific population, we'd be really interested in hearing about that, supporting you where it makes sense, tracking your results. We are also developing an adult version that Denise's team is leading that's not ready for national use at this point, but just, you know, something that you'll continue to hear about from us. So at this point, we've covered all of the questions that have come through in the chat. I'm going to quickly go through the next steps because we can see that some people are logging off, and then I'll open the lines if there's anybody that has questions on the phone. So if you could get ready to open the lines, and again, just a reminder to mute your phone unless you're speaking. So in terms of next steps, this slide has a reminder. There's a link that you'll be receiving with the follow-up materials. If you could answer our little 3-question survey, that would be really helpful for us in terms of getting a sense of how many of you that were on today's webinar are thinking that you'll actually utilize the materials and when you think that you might be ready to launch, just so we can plan our resources internally. The second item on this slide is a reminder of the email address. So when you're ready to initiate the onboarding process, send your email to that email address, and we will get back to you as quickly as possible. The website there, that's the Moving Healthcare Upstream, is an initiative that Nemours leads in coordination with UCLA. The materials for this presentation are on our Moving Healthcare Upstream website. So I just don't want you to be thrown off when you go to that link and it's not Nemours specific website, that you are in the right place. But where you'll get the information about this project, that is probably where you went to register for this webinar, and that's where the slide deck and materials are, and the recording will be. So that's it in terms of next steps. And if you're ready, could you open the line and we can have people, if there's any additional questions, we can try to field them. It's a bit choppy to take questions with this many people, but if anybody has questions, feel free to speak up. The lines are open.
Hi, it's Adrienne Mullick from Oregon, and I was curious to the extent to which promoting the adolescent well visit is covered in this curriculum.
So it's in there about they should go for their annual visits. We don't go into specific details of what occurs during that visit, but we talk to them mostly about, do they have a primary care doctor? Do they know how to get one if they don't have one? If they're seeing a pediatrician currently, you know, what age out of their system, because the health system has a different age. And then if they are going to be aging out, how do they find then a new provider to take that position, to become a primary care provider? So we don't really go into details of what is covered in the visit, but we help them through the visit and know what kind of questions to ask, tell them about writing down their questions, because they've heard it all, seen it all. So no shocks doctors these days. That's as far down in detail as we go, because again, we were constrained by a classroom situation.
Wonderful, thank you.
I have a question. Hello?
Go ahead.
And it's related to the last question. Has anybody added supplemental information? For example, if you then teach supplemental information about how primary care well visit and what happens in that, maybe using the AAP guidelines, would that be acceptable?
Absolutely.
Yep, absolutely. So what we mentioned earlier in the call that we will create, that you all have access to in Google Drive, a folder full of supplemental materials that other users have shared with us already. And we encourage you to share with others, share them with us, we'll share them with others, and hope we'll create some sort of either a Facebook or Twitter user group so that you can ask questions and speak directly with another about, enhancements that anybody wants to make. We strongly encourage you to do that. Somebody else had said hi. There was two questions kind of coming at the same time. Could that other person speak?
Yeah. Hi, my name is Sarah Hall. I in Montana. And my question was, if the system has been adapted for specific populations, particularly Native American populations. Out here in Montana, we have the Indian Health Services that provide service to our Native populations, and it's quite a bit different than maybe a general health care system. So how difficult would it be to adapt this for IHS?
We would with you, because we know
that's our area of expertise. We would be more than willing to talk with you, support you whatever way makes sense. We've not adapted it for that specific community at this point. But, you know, again, we want to get the information out there and are more than willing to have side conversations with you to see how we can help that process along.
Sure. Thank you.
Thank you.
Thank you.
Anybody? Seems like we are out of questions. It's great, and we're right on time. That's perfect. Emily, you can mute the lines back if you want. Thanks. So for anybody that had a question perhaps and wasn't able to answer it, please feel free to submit them to the email that's on the slide, the NTHCS@nemours.org. We will be more than happy to follow up by call or by email to that. And thanks so much for your time and participation. It was great. We're so excited that we had 25+ states with us on the call today, and we look forward to partnering with you to increase the health literacy of the adolescents we serve. Have a great afternoon, everyone.